I told you I was going to briefly talk about resistance mechanisms. So, resistance mechanisms basically means when osimertinib or erlotinib or any of the tyrosine kinase inhibitors that you're on stop working. Why do they stop working? They stop working because your lung cancer got smarter than the drug. So, how does the lung cancer get smarter than the drug? Well, there's lots of different ways that it can outsmart the drug. And we are just starting to learn about this. But here are the most common ways that I've listed, but there are many other mechanisms that I am unaware of and that we have not learned about yet. So this talk is evolving. But we have on target resistance mechanisms and off target. On target would be developing a secondary EGFR mutation. And an off target would be developing a different kind of alteration, like MET amplification, or a RET fusion, or an ALK fusion, or a BRAF alteration, or HER2 amplification, or a HER2 mutation, right? So identifying what is causing the drug to not work anymore is essential. So anytime you are on a drug that's not working, I really want you to advocate for yourself, to ask your oncologist to biopsy an area that's growing and to send a liquid biopsy, to send next generation sequencing on that tissue biopsy and in your blood to identify if you have any of these resistance alterations, because there are clinical trials that you could go on or be, at least privy to, that will help target these resistance alterations, and give you a little bit more of a targeted therapy approach for your next line of therapy rather than chemo. However, if there is no resistance alteration identified, as you can see here in the orange, you may be more appropriate for standard of care chemotherapy or a different kind of clinical trial. And then we have lineage plasticity, which is when your non-small cell lung cancer has completely transformed to small cell or to squamous, in which case we need to start looking at small cell chemotherapy regimens or squamous cell chemotherapy regimens, because this unfortunately is a poor prognostic factor. And identifying it as quickly as you possibly can so you can get on the appropriate treatment is essential.